At what age should Black men start to begin regular heart screenings, and what does that look like besides the CT calcium scan?
That's a really
And
good
is that
question.
is that the starter one, or can you yeah.
So that's a really good question. So the the screening of heart disease really happens at any wellness visit, and
Mhm.
so this is where because although coronary artery disease is one type of heart disease, there are other types of heart disease. Your heart can become weakened, it can fail, it can become stiffened or fibrotic, it can become electrically unstable, and you can start to have rhythm disturbances. So there's a lot of things that we do as doctors in visits to screen people for disease. And so I'm a big advocate of the spoken wheel model with a primary care doctor at this, at the center of the wheel.
What's a spoken wheel?
So the
Doc-
spoken wheel model is sort of the you have a primary care doctor who assesses you for wellness, but also recommends age appropriate screening tests.
Mhm.
So, for example, I had a family history of colon cancer. So I was recommended for screening colonoscopies earlier than
Same.
the average patient. And and there are a myriad of other things: breast cancer screening, prostate cancer screening, coronary disease screening.
Mhm.
And there's a primary care doctor is keyed in on not only maintaining wellness, so talking to you about your diet, and should be talking to you about mental health and making sure you're observing healthy lifestyles and making sure you get referred for the age appropriate screening. And so the idea is that if we can find the right people to screen at the right time, we can prevent disease before it happens.
Mhm.
So that's the role of so that's the center of the wheel. And then if they see abnormalities, like for example, a really high calcium score, right? And now they're unsure about what does the data show for further testing. What's the right test for Melyssa?
Mhm.
Then they can refer you to a cardiologist, and that cardiologist can say, well, the latest data suggests X or the latest data suggests Y. And that changes.
Mhm.
It's a little bit of a moving target, but over time we get a better understanding of um, how best to practice medicine.
Mhm. What tests do you think what tests should be included in a routine health checkup?
So depends on the age of the patient,
Mhm.
depends on what the patient's coming in reporting in terms of symptoms, and depends on family history and other things. So it's a little bit of a tough question to answer. But in general,
Should cholesterol, blood pressure, and glucose levels be checked at every visit to the doctor?
so uh, in most adults, the answer to that is yes.
Okay.
Um, Lipid profile as a screening test is recommended for every adult over the age of 35, 40.
Mhm.
And if you have familial disease, it's even recommended earlier.
Mhm.
Or if you have evidence of disease in the cardiovascular system, it's recommended earlier.
Mhm.
So so yes, that should be done for every adult who for whom there's a suspicion of heart disease.
Mhm. So, let's talk about prevention and lifestyle. There's a lot of I guess, diets and whatever else, there's vegan, there's Mediterranean, there's keto, there's paleo, there is I don't care, I'm just eating whatever I want to eat kind of thing. But what diet is most effective for preventing heart disease in Black men? And also, how bad is alcohol? Because some doctors say don't drink it at all, like completely don't drink it ever. And some doctors will say, well, moderately, maybe one drink a week is okay, or, three drinks a week, or whatever the case is. But what's your thoughts on that?
So I'm so glad you asked. So
Mhm.
I have a close personal friend who um, has a weak heart
Mhm.
and asked me the similar question yesterday, in fact. And he is under the care of a cardiologist for his weak heart. And he said to me, well, my doctor said I could have a drink once in a while. And my answer to him was, no, you can't. We know alcohol is a cardiac toxin. There's no doubt about it. What we don't know is why some people behave more dramatically to the effects of alcohol than others. So some patients, they'll have a drink or two and they can develop heart dysfunction from that. Other patients can have, a fifth of liquor and they won't develop any heart dysfunction.
Can you describe like how alcohol affects your heart?
So it's directly toxic to heart cells, and it causes heart cell death. We
Okay.
know that. If you like, we see acute alcohol intoxication cause things like weakened heart muscles. We see it cause rhythm disorders, both of the top chambers of the heart and the bottom chambers of the heart. So alcohol is a known cardiac toxin that causes heart dysfunction of the conduction system, of the contractile system, meaning so it causes electrical dysfunction and mechanical dysfunction of the heart. What we don't know is that there are some people who are chronic alcoholics and their hearts are healthy. It's just like there's some smokers who smoked for 40 years and they
Never develop lung
never developed
cancer.
lung cancer or never developed heart disease. But I would say you're one of the lucky ones,
Mhm.
right? And so if if a patient has heart disease or is concerned about developing heart disease, I certainly would say um, avoid excessive drinking, and that's defined as like more than 4 ounces of alcohol a day for a man for a woman, and um, or more than one alcoholic beverage for a woman and more than two alcoholic beverages for a man.
Mhm.
Um,
People are definitely going to want to know, is there certain types of alcohol that's worse than others, or is
uh,
just anything with an alcohol content?
I I don't know the answer to that, but what I would say is, I think that red wine has traditionally been thought of as, heart healthy, and
Antioxidants.
right,
Yep, that's what we tell
yeah,
ourselves. Yeah.
but
When we
certainly
take a bottle to the
right, if
head.
you had a bottle of wine, I think that would probably be cardiac toxic. So, you know, what I would say is for patients who have existing heart disease, particularly a weak heart or a rhythm disorder, I would say avoid alcohol at all.
Okay.
Most doctors don't say that to patients because they don't want to scare people away.
Mhm.
Alcohol is quite addictive, and people
Like it.
who like it,
Yeah.
and they may not go back to their doctor after getting that advice. But the truth is that there's only potential harm and no potential benefit.
Mhm.
Um, so I often, and same thing with smoking. Like if people smoke, I tell them don't inhale anything into your lungs that's not fresh air,
Mhm.
because along with the toxic effects of alcohol and tobacco, um, inflammation is a huge problem for a myriad of diseases, but heart disease in particular, because inflammation is what sort of turns on or accelerates the progression of those plaques.
Yeah.
So if you have high cholesterol and you have an inflammatory um, sort of baseline, you're more likely to put those fatty lipids into the walls.
Mhm.
And that's the way I tell my patients sometimes. Um, it's like shove it. It's like when your kid is cleaning their room and shoving everything under their bed. That's what the inflammatory cells are doing. They're grabbing all of the fat particles that are floating around in your blood in high number, and then they're shoving it into the vessel wall and doing it in a very disorganized way. So those fatty deposits in the wall can be very unstable, and they can suddenly rupture and cause a clot.
Mhm.
And so you can go from having a vessel that's open
Mhm.
to having a vessel that's closed suddenly because you have this really unstable fat deposit in your vessel.
Mhm.
And that's what a heart attack is. It's a sudden popping of that plaque, and you go from having um, a vessel that's open to a vessel that's totally closed and not providing any blood to the heart muscle
And that can happen just
in an instant.
wow.
Yeah.
Okay. Going back to the diet, what as a cardiologist, what is your favorite, diet or, kind of lifestyle for people to follow in terms of what they consume, the food that they consume?
Um, to that same vein, um, non-inflammatory foods.
What
And
does
so
that look
what
like?
do I mean by that? Foods that are high in saturated fat and trans fat are highly
So like
inflammatory.
fried
Fried foods.
foods,
Yep.
okay.
So I I try to tell people avoid them if possible, and you're going to enjoy things, but less is always better than more.
Mhm.
It shouldn't form the staple of your diet. Um, but foods that are very high in preservatives,
Mhm. So that
um,
would be like charcuterie boards, like
yeah,
the
cured meats,
cured
and
meats.
yep,
Mhm.
yep. And they're also very high in sodium. Those types of foods, so they
Mhm.
they cause water retention and
Mhm.
higher blood pressures.
Mhm.
Um, uh, so fresh fruits, vegetables. lean meats,
Mhm.
avoid the dripping, like the gravy, so
Mhm.
to speak, the sauces that go on.
The
You know,
good stuff. Yeah.
I'm from a West Indian background, the sauces that go on rice,
Mhm, mhm.
and on meats, those things I would leave to the side. The lean cuts of meat are better.
Mm.
Um, Fish oils are better. I would avoid seed oils, so like canola oil or sunflower oil. I would prefer using things like olive oil or avocado oil.
Mhm.
Um,
High fiber.
High fiber, so whole grain, whole wheat bread.
Mhm.
Um, Less sugar.
Mhm.
I mean, I think we take in way too much sugar
Yeah.
in general, and I would avoid things with high fructose corn syrup like sodas and artificial juices and stuff like that. Like that stuff, I would just completely eliminate.
Okay. So how much exercise is needed to maintain a healthy heart? And, is there specific lifestyle changes that can have a greater impact for Black men?
So the American Heart Association and the American College of Cardiology, they actually have formal recommendations on this. So the recommended amount of exercise for an adult male would be like 150 minutes of cardiovascular exercise a week.
Mhm.
And so I tend to tell my patients to break that up into at least 30 minutes a day, 5 times a week, which is the basic, right? So
Mhm.
if
That's
you
baseline,
right,
guys.
that's
That's the bare minimum. I
right,
know y'all know what the bare minimum of things is.
right.
Bare minimum. Go ahead.
And so that doesn't mean like, going for a leisure walk,
Mhm.
right? That means like getting your heart rate up. Like I tell patients, if you can have a conversation while you're exercising, you're not exercising,
Okay.
right? You should be getting after it, so to speak. Preferably sweating. Your heart rate should go up into the sort of cardio zone. Um, but if you did at least 30 minutes 5 times a week, that would be the bare minimum, and that would maintain health. But if you're looking to build health or recover from a sense of unhealth, I would try to do more,
Mhm.
but build up to it. You
Okay.
know.
Okay. So, other than, increasing your exercise, what's another lifestyle change that men, especially men that are heading into their 40s and their 50s, we all know that, we start to become a little sedentary. We sit a lot more, we lay down a lot more, we take more naps, we probably eat a whole lot more. We're just not as active as our younger selves once were.
That's correct.
So what are some dramatic, small but significant lifestyle changes that somebody can make that would have like a really great, impact on heart health?
I think maintaining like muscle mass is very important. I think weight training is also very important. It has a lot to do with your level of mobility.
Hmm.
The more muscle mass you have, the more likely you are to be mobile
Hmm.
into your aged years.
Hmm.
So I definitely recommend, like, if someone wanted to lift and do more weight training and strength training, it has positive effects on bone density, it has positive effects on mobility and also cardiovascular health. So that's another lifestyle change. I would try to eliminate stress.
Hmm.
Um, that's a hard one to do in the
That is
current.
a hard one to do because stress, you would say that stress is, or would you say stress is the basis for um, the the onset of the early markers of heart disease, which is high blood pressure, hypertension. Am I on the right track here?
So yeah, so stress can certainly have an effect on hypertension. Like high blood pressure can come from a lot of things, like salt sensitivity, like as we certain particular ethnic groups have higher salt sensitivity than others.
Mhm.
African Americans are known to have higher levels of salt sensitivity. But things like stress can cause blood pressure. Things like atherosclerosis can, or plaque deposits can make arteries stiffer and less pliable, and cause higher than normal blood pressures. So hypertension is one of those things that has a lot of sort of potential causes. Weight. So
Mhm.
for example, if I pack on a lot of unhealthy weight, I'm more likely to have high blood pressure. Um, so elevated weight, being overweight, which is defined as a BMI over 25, or obese, BMI over 30, you're more likely to develop hypertension, diabetes.
I was gonna ask you about the correlation, the relationship between cardiovascular disease and diabetes, specifically type 2 diabetes, which is something that isn't necessarily genetic. It's something that you can develop based on poor, lifestyle and eating habits, correct?
Sure, sure. And I diabetes has a very, we consider diabetes mellitus, or type 2 diabetes, um, uh,
A precursor?
a coronary risk equivalent. So when I see somebody that has diabetes, I think of them as having heart disease.
Wow.
Like, it's the relationship and the correlation is that strong. So if I have somebody that comes in and they're a diabetic and they're telling me, "Hey, everything's fine. I don't have any symptoms. I'm pretty active and I'm doing okay." I'm more likely to screen that patient than I am a patient who's not a diabetic and who's doing well and has a lower risk factor profile.
Mhm.
Because I assume that every diabetic patient has coronary disease until they've proven to me otherwise.
Mhm.
Um, just because the correlation is so strong.
Mhm.
The other thing is that diabetes, um, is sort of this quasi-inflammatory state as well.
Yeah.
And so it leads to plaque destabilization and more plaque rupture or heart attacks, than people who don't have diabetes. So I treat diabetic patients very aggressively.